All right, guys, this is going to be my run through of fluid and electrolytes. So I'm going to be talking about sodium, potassium, calcium, and magnesium in this video. So the first one we're going to go over is sodium. So the normal range is 135 to 145 milliequivalents, and its main function is going to be fluid, like so its main function is going to be fluid balances and neuro, and also muscle function. So hypernatremia is going to be a value of above 145 milliequivalents, and causes for that can be dehydration, excessive sodium intake, and diabetes insipidus, because you're peeing out all the fluid, which is gonna make your blood more concentrated with sodium. So signs and symptoms, you're gonna think high means dry, so thirst, dry mucous membranes, confusion, restlessness, and also seizures. So the nursing interventions are going to be to monitor their neurostatus, and you also want to put them on seizure precautions. So you want seizure pads on the bed. You're going to administer hypotonic fluids. So those would be like 0.45 normal saline. You're going to encourage oral intake of fluids if able, and you're also going to limit their sodium intake. And the opposite of that is going to be hyponatremia. So that would be a value below 135 milliequivalents. Causes would be fluid overload, SIADH, and overuse of diuretics. So signs and symptoms are going to be the same, pretty much the same. It's going to be headache, confusion, nausea, seizures, and muscle weakness. So for nursing interventions, you're always going to want to monitor their neurostatus and implement seizure precautions, and also like their fall risk precautions as well. So you're going to do neuro checks, you're going to monitor their INOs, you're going to administer hypertonic saline, and you're also going to do fluid restriction and, like I said again, seizure precautions. So the next one is going to be potassium. So when you think of potassium, you're going to think cardiac. So the normal range of potassium is 3.5 to 5 milliequivalents per liter. So the function of potassium is cardiac rhythms, muscle contractions, and also nerve conduction. So when you look at potassium, just think cardiac. So hypo and hyperkalemia can lead to cardiac dysrhythmias. So hyperkalemia, which is above 5.0 milliequivalents. So causes of that would be renal failure and overuse of potassium-sparing diuretics, and also tissue trauma. So think massive burns or like gunshot wounds, kind of things you would see like on a trauma floor or a burn floor. So signs and symptoms are going to be muscle cramps, peaked T waves on a ECG, bradycardia, and cardiac arrest or dysrhythmias. So nursing interventions, first things first, you're going to put them on a cardiac monitor. You're going to administer, depending on what it is, on how high it is, you're going to administer either K-exolate, an insulin drip with D50, or calcium gluconate. You're also going to restrict their potassium intake, and you can also give loop diuretics like Lasix to help lower the potassium as well. Inverse to that would be hypokalemia, so that would be a potassium level below 3.5 milliequivalents. And the causes for that are going to be overuse of diuretics, nausea, vomiting, diarrhea, overuse of NG, suctioning. The signs and symptoms of that are going to be muscle weakness, and it's going to look like flattened waves on an ECG, and constipation, and also like arrhythmias. So nursing interventions, so you're going to put them on a cardiac monitor. You're going to administer either oral or IV potassium. Typically, if the potassium is above 3.0, like if it's 3.0 to 3.5, it's usually oral, but if it's below 3.0, it's usually IV, but it depends on what facility you're at and the protocol for that. And you never push IV potassium as well. And you're gonna educate on the patient on eating like higher foods with higher potassium and monitor their labs closely. Next one is going to be calcium and magnesium. So let's start with calcium. So the normal range of calcium is 8.5 to 10.5, and the function of calcium is for bone health, muscle contraction, nerve transmission, and it also helps with blood clotting. So hyperkalemia is going to be above 10.5 milligrams per deciliter. So causes are hyperparathyroidism, cancer, and overuse of like thiazide diuretics as well. So signs and symptoms, so you're going to think lethargy, and you're going to look at their reflexes as well. So they're going to have decreased reflexes, constipation, and also kidney stones. So nursing interventions, so encourage fluids, and you can diurese them as well. And you can also give calcitonin to lower the calcium, and you also want to be monitoring their kidney function as well. So hypokalemia would be a level below 8.5 milligrams per deciliter, and the causes for that are hypoparathyroidism, a vitamin D deficiency, and also renal failure. So the signs and symptoms, so they're going to have a positive Chavatsky and Trousseau sign. So when you tap on their cheek, their facial muscle is going to twitch a little bit. And then a positive Trousseau sign would be if you inflate a BP cuff, their hand is going to go like this. So the interventions for that, so you can give oral or IV calcium. You are also going to monitor for seizures, monitor their airway because they can have laryngospasm, and you also want to monitor their vitamin D as well, and encourage vitamin D because if they're low in calcium, they're probably going to be low in vitamin D. So you could do supplements or just encourage foods with high vitamin D. Next one is magnesium. So normal range for magnesium is 1.6 to 2.6 milliequivalents per liter. Function of magnesium is to support muscle and nerve function, cardiac rhythm, and your cardiac rhythm. So hypermagnesium is going to be caused from renal failure and excessive use of like antacids or laxatives. So signs and symptoms can be low blood pressure, decreased reflexes, bradycardia, and respiratory depression. So nursing interventions would be to hold any magnesium containing medications. You can administer calcium gluconate. It's the antidote to hypermagnesium. You can also monitor their reflexes and their respiratory status. And they may or may not need dialysis depending on how severe it is. So for hypomagnesium, which is a level below 1.6, causes can be alcohol use, diarrhea, overuse of diuretics. Signs and symptoms, biggest thing you want to make sure is that you want to put them, the signs and symptoms are like tremors, seizures, and increased reflexes and arrhythmias. So you want to put them on You want to put them on seizure precautions, and also encourage magnesium rich foods, and also administer oral or IV magnesium. All right, and that's it.